people from my Ultradent family. I am here with a special guest today, Dr. Joshua Austin. Josh, say hello to everybody. Give us some background about you.
Hello, Ultradent Nation. I love all the Ultradent products, so I'm like thrilled to be here. I'm such a huge fan of Dan Fisher. We talked about it a little bit before we went live, but I think for my money, one of the most amazing men in dentistry, to be honest with you. Like he is not only a genius dentally, but he is a very kind soul, and he does a lot of outreach. And if you don't know what I'm talking about, you should look into it, because he is a pretty amazing human being. So you work for a pretty good guy, and that's why I like buying Ultradent products, is because I know it comes from a family-owned business, from somebody who's doing the right thing. So I'm a restorative dentist, full-time private practice dentist in San Antonio, Texas, and I write for Dental Economics.
That is amazing. Dr. Dan Fisher is so nice. I kind of already told you this, but I'd only been working for Ultradent for a month. And he, every time he saw me, would say, "Hello, Hartley," like knew my name instantly. There are a lot of people that work at Ultradent.
Yeah.
And I'm so impressed with you.
If not thousands, right? Yeah.
I think it's like 1,600 or something like that. And it is global too. So for my first month of him being able to say hello to me in the hallway, I was like, you don't have to remember my name. It's okay.
We talked a little bit before we got started about authenticity. And I think Dan Fisher is like the poster person for someone who is truly authentic. Like he has no problem telling you how he feels and what his opinions are, and he puts his money where his mouth is. And he doesn't placate people. He doesn't. He does and says what he feels is right, whether or not other people agree with it or not. And I think that's somebody like that, to me, is the definition of authentic. So I would be, if I lived in South Jordan, Utah, I would be proud to be somebody who worked for Ultradent.
Well, if you move here, come on board.
I'd love to. That'd be so fun.
Awesome. Well,
I've seen your clinics there.
They're pretty cool, huh?
Yeah. Very nice.
We're here to talk about the mental dental connection. There's a lot of uncertainty in the past 2 months. We're now into May. Some offices are opening up. Some are maybe going to be opening up in June. And people are talking about mental health, but let's talk a little bit deeper on this Facebook Live, mental health and dentistry. What do you think?
It's a shame that it took a global pandemic to get people to think about it, because this is not a new problem in dentistry. This has been a problem in dentistry for decades, and no one wants to talk about it. And it's a real problem. And I've got some statistics that we can go over. But at the end of the day, I think it just comes down to anecdotal stories. And all I can do is share with you kind of my journey through realizing how hard this profession is and how we can't get through this alone. And we are by nature and by training people who fix problems that we see, right? We image we do imaging, we do evaluations and examinations, and then we develop a problem list, and then we develop a treatment plan, and then we surgically fix those problems. It's what we're trained to do.
Right.
And these aren't problems that you can do that with. And so we get really uncomfortable sharing and talking about it. And it's just a problem throughout the profession. Statistics say it so, but I know it from not only myself and what I experience on a daily basis, but people I know and love who are also in dentistry who go through these ups and downs. And it takes a global pandemic to kind of throw gas on that fire. But let's not kid ourselves and think that there have not been plenty of practices struggling before this ever hit. And dentists struggling with their mental health. So this needs to be something that we get comfortable talking about and comfortable addressing, because the biggest problem that I have is we go to a CE conference, right? Like a couple years ago, I spoke at the Utah Dental Association meeting. And it was great. It's in downtown Salt Lake City at the convention center. It's a pretty big meeting, a few thousand people there. I would guess 4,000 or 5,000 people. I had a big room of probably 250 people in the audience. And I look at the program and see who, first of all, I'm kind of looking to see if I know anybody there speaking, but I'm looking at the topics and whatnot. And it's always restorative dentistry and veneers and full mouth rehabs and all on fours and implants and sinus grafts and all that kind of stuff. And there's never anything about mental health in dentistry, ever. And if there is a wellness program, it's someone like my friend Uchi Odiatu, who's in Toronto, who's great, and he has a great wellness program, but it focuses on physical wellness and exercising and eating right and diet and all that kind of stuff, and that's awesome. But no one is out there talking about how do we get our heads right, and that's probably just as important as the other stuff.
Agreed. And it's uncomfortable to talk about because you don't want your friend to know that you're struggling. You don't want your team to know that you're struggling.
Yes.
And also that can be one of the things that helps you.
Yeah.
So, and I feel like dentistry has like a higher incidence of mental health issues. I remember like 10 years ago when I was coming into dentistry, they even said like dentists have the highest suicide rate. And I was like, what? Why? We do great things. We change people's smiles and lives and even personalities, you know?
Right. Sure. That's that's great. And that's awesome. And that's really, really rewarding. But those days, those like days where you hand someone a mirror and they start crying, like that doesn't happen enough, unfortunately, to make up for some of the other stuff that we deal with. And before we started, I just like jotted down some notes of like, why I think dentistry is so difficult. And this is just like off the top of my head in like 2 minutes. The things I came up with is number one, like dentistry itself is difficult, right? Like procedurally, dentistry is difficult. There's no such thing as mastering dentistry. No one will ever be a true master. Now you can earn a mastership in the Academy of General Dentistry, which is fine. But that doesn't make you a master of dentistry. A simple extraction is simple until it's not simple anymore, and even the most experienced clinicians have failures. And if you go to the Spear Institute, or you go see John Coyce, or you go see Gordon Christensen over there in Provo, they'll all show you failures of cases they did, and these are arguably the three greatest dentists in the world, right? Frank Spear, John Coyce, and Gordon Christensen could be, considered by and large in that group, and these guys all have failures too. So if they have failures, that means I'm going to have failures, right? So we deal with failure on a daily basis, which is really difficult. It's difficult to keep your self-esteem up high when you see stuff like that, right? Agreed. And there are some people who can deal with that better than others. And I don't want to use the term sociopaths, but we all know people who have all these failures and can just move on and sell the next big case just like that and know that they're going to have problems, but it doesn't matter. But for the vast majority of us, when we have a failure, we take it home with us and it hurts us. It hurts us mentally, and we compartmentalize it, and we push it down, we push it down, we push it down until something explodes. Managing dental team members is difficult, right? So you're a hygienist, right?
Yes.
Okay, so there seems to be a little bit of a chasm developing right now between hygienists and dentists, and I don't know if you've observed that.
Definitely.
But this is only making it worse, right? Like, dentists know, hey, we need to get back to work at some point. We're going to do that as states, allow us to, and as we have the PPE. But you have hygienists who are involved in organizations of their own, ADHA and whatnot, that are pushing from a legislative standpoint to not even allow anything, right, from dentistry and to circumvent the dentists altogether. And so now you've got this widening chasm amongst hygienists and dentists. And that makes it difficult, right? So managing team members without a global pandemic is really hard. Now throw this on top of it and it's fuel on the fire, right?
Exactly.
Most dentists, I don't know the numbers. I don't have at least updated numbers. The last number I looked at was from 10 years ago that showed that 65% of dentists were solo practitioners. That number's probably lower now, but there's a great isolation in being a dentist, right?
Yeah.
We're most of the time the only one at our degree level in the office, and we work with people underneath us and try to delegate to them or whatnot. But our interactions with other people, with other dentists, tend not to be on a daily basis in our offices, right? They tend to be online or at study clubs or at dental meetings or whatever.
Right.
And I've been watching. Have you been watching The Last Dance, the Michael Jordan documentary?
Yes. I don't know a lot about sports, and my cute husband was like, "Oh, I'll watch this without you," and I'm like, "No. I actually know Michael Jordan. I would like to watch this with you."
Okay, good. So, I'm a huge sports fan in general, and I, was a teenager. Yeah, you can see all my stuff behind me.
Yeah, you got you got baseballs. You're way into it. This is perfect.
Everything. Yeah. as a teenager watching Michael Jordan, I remember all this stuff from when I was alive and from when I was a kid, and watching like the late 80s Bulls, before Jordan got Pippen and before he had won a championship, he was trying to do everything himself and everything ran through him, right?
Mm-hmm.
And there are days that's how I feel. I watch Jordan in some of those games on the documentary and see him getting frustrated and yelling at guys and trying to get people to see things on his level, and they can't because they're not Michael Jordan, right? And not to compare myself to Michael Jordan, but sometimes as the only dentist in a dental office, everything has to run through you, right? So you're the focal point.
Yeah.
Right. Yeah, you have to be kind of quarterbacking everything, right?
Mm-hmm.
And that's stressful. That's really hard. And, now we're seeing more and more group practices because dentists realize that it's a lot easier, to have someone else around and to be able to do that. And now, it's like Pippen, and now, Jordan got Pippen, and now things, now the game flows a lot better, right? Well, a lot of dentists still don't have that. I'm in a solo practice. It's just me, and 3 hygienists and 2 assistants and 2 people at the front desk. And there are times where I feel like everything has to go through me, and I'm making all these decisions on a daily basis. And every one of those decisions adds a little bit of weight, adds a rock into my backpack. And by the end of the day, you feel so weighed down that, like, you've given all of your energy and effort at home. So isolation's an issue. Finances are an issue. Finances are always an issue. It's difficult to manage the finances of a dental practice, even in good times sometimes. And now throw this on top of it, and people not knowing how to use their triple P, and not knowing, how to handle unemployment claims and all of that stuff. And this just compounds it. And the fact that, like, hey, who knows when we're going to be running at full steam again, if ever, right?
Right.
So this is just more fuel on the fire, right?
And then you add in the extra cost now, PPE.
Right. Yeah, and how do we bill for that, and how do we make that work financially?
Yep.
Yeah. It's just difficult. And so, overhead tends to creep up over time. Many dentists are overstaffed. Many dentists could get away with less staff than they have, especially administratively. But it just sort of happens. We call it staff bloat. Staff gets bloated sometimes. And so, that causes overhead to creep up. Plus there's, no offense to you guys who are a dental company, but there's always someone trying to sell you something, right? There's always somebody coming through the door with the latest and greatest things. And now it seems to be all PPE related. And I see these companies selling these, like, vacuum systems that you put in a room, and negative pressure systems and all that stuff. None of which have any evidence to show that they work and that they prevent any transmission of the coronavirus and any of that stuff. But there's always pressure to buy stuff, right? So there's always a newer, shinier thing on the market. We talked before we started about the Gemini laser, right? Which is my favorite laser. It's amazing. It's the coolest laser in the world. But, some dentists don't have the ability to be able to spend that kind of money on it, at any given time. And that's stressful. And then we talked a little bit about authenticity, right? And one thing that I see has been a problem over the last couple of years is the rise of quote unquote dental influencers. And when I said that word, you asked me about, like, the singing dentist, the eyebrow guy.
I love the eyebrow guy. I do follow him because he's a singing dentist. He's like always making up these cool songs, and then I want to try and remake them, and it's not really great, but I try.
He's skilled. He's very skilled. He's not exactly what I'm talking about. Although I would consider him a dental influencer, he's not selling a lifestyle. And there's a lot of dental influencers who sell a lifestyle. And what I mean by that is they will make casual mention of how much money they produce. They'll talk about, if you're not slamming home 400 or 4 million a year as a single doc, you're not, you're obviously, you're working stupid, or you need to drop the plans, or we're all fee for service here. And, you have these people that drop these little kernels of information to make you think that they are these amazing businessmen or amazing clinicians, whatever it may be. But there's really no vetting of any of that. Anybody could go on and say anything. And so we end up comparing ourselves to all these people and trying to keep up with the virtual Joneses. And that is a pathway to self-loathing and depression and constantly thinking you're not good enough.
Right.
And I've argued, in my opinion, there's really only 4 or 5 real dental influencers. We talked about 3 of them already.
Dan
John
Fisher.
Coyce. Well, I mean, I would put Fisher up there. But Fisher is really in a different seat because he's the CEO of a company. I'm talking about people more in sort of the CE world.
Right.
It's Dan Fisher would be, from a company standpoint, but it's Coyce, Spear, and by default, Greg Kinzer, who's with Spear, Gordon Christensen. And if I'm going to reach for somebody who's a social media personality, it's a guy named Michael Appa. I don't know if you know Michael Appa.
I don't actually know him, but I will be doing some research.
Yeah, do some research on Appa. Appa's the real deal. But Appa, is in Midtown Manhattan, and he does pretty much all comprehensive dentistry on the rich and the famous.
Right.
And his practice is going to be different than my practice in San Antonio, Texas. And so if I'm one of his 280,000 followers, and I'm looking at a story and wondering why I don't drive that 1965 Ferrari GT California edition, it's because I'm not as good as him, and that's not the case. It's we're in different scenarios and whatnot. So I think there's a lot of situations or a lot of issues with flicking through Instagram, and you see a gorgeous dental case, or you see a gorgeous dental office, or you see some dentist on some beautiful vacation, and when you see that, you flex a muscle in your arm or in your mind that says, I'm not good enough, right? And you flex that muscle enough, and next thing you know, that I'm not good enough muscle gets a lot stronger than the I am good enough muscle on the other side that doesn't get worked out as much, right? And so, I encourage everyone, for the love of God, take a 2-week social media vacation throughout the year. It doesn't have to be 2 weeks all at one time. You can break it up a week here, a week there. I took like 5 months off of Facebook earlier this year.
Wow, 5 months?
It was so amazing. It was so great. It was, just not having that constant noise is really, I think, enlightening of how much noise it really is. Yeah, so when I came back, what I decided to do was no Facebook on my phone.
Really? Interesting.
So only on my desktop. And so that means there's a much more limited time that I get to look at it. Yep. So I just turn down the noise. Now, Instagram's a hard one because you can do it on desktop, but it's not a desktop really.
You can. You cannot do it on desktop. It's like, it doesn't work.
You can kind of look really, but that's it. You can't really post. They just added DMs on the desktop version 2 weeks ago or something. Yeah, so you don't get the full deal. But I just put a restriction on my phone of 30 minutes a day. So when I get to 30 minutes on Instagram a day, my phone pops up and I just don't go back on it for the rest of the day. So I just think we need to limit some of the stuff that we have. I'm not saying social media is all bad, because it's not. There's some great things. I have some great friends that I know from social media, like Hartley, of course. But I just limit it, because it just, especially for people who have the personality of dentists, especially when you follow a lot of dentist accounts, man, it just really does a number on your mental psyche. It really does.
And I'm with you. I actually have to, because I do social media for my job right now, I actually have to move it off of my homepage, because I will subconsciously, I notice myself going into it, and I had no idea why. And
it's also habit. It's just habit. You're addicted to it.
I see it, and then I'm like, okay, wait. So I turned off my notifications. I put it off of my homepage. So sorry if I ignore you. Sometimes not on purpose. But then also, if I'm following somebody that ever makes me feel less than who I know I am,
I unfollow liberally.
I have to unfollow them.
Yeah,
and it's
for sure.
Itself, it's nothing against them. They haven't done anything to me. But
if it makes me feel bad about myself, I'm out.
I can't.
It doesn't inspire me.
Yep. So
my other tip for social is only follow dog accounts. So that's one of my favorite tricks.
That's the best advice I've ever heard.
I follow a lot of dogs, and it just that's something that it always makes me smile. And I see we got a comment from Kevin, and I call it in dentistry we have I call it dental pornography, and there are cases that people post that are posted with no context whatsoever, but they're always gorgeous cases and they look amazing. The photography's amazing. The dentistry's amazing. And you look at it and you just think to yourself, I'll never be able to do that. I'm obviously not as good as that person. Yeah. And that's a really crummy way to lead your life and fill your time with this thing that's supposed to make you feel good. Yeah. And those little insults to your own psyche don't help. And I can tell you there's one dental Instagram account. There's one that
Ultradent?
is, well, so there's two. There's Ultradent Dental Instagram account that's good. There's a Instagram account made by the guys at UAB, University of Alabama, Birmingham, called Dental Tube. And it's all like Dan Fisher stuff. It's all like bond strength and all these tips, and it's got great information on it. But it's made as an information vessel. It's not made to show off our beautiful dentistry. Right. Whereas most dental Instagram accounts are the exact opposite. They're made to show off. They're not made to educate. And so I think that's a difference, is stop following these dental porn accounts and follow the dental accounts like Dental Tube that teach you something without making you feel bad. And so that's kind of what I would recommend for social.
Yeah.
And then the last thing, that I think is tough for dentistry is that no one's happy to be here. We don't sell ice cream. And so the vast majority of patients aren't super stoked about being at the office. They may like getting their teeth cleaned. They may like the feeling of having a prophy. They may like that, but they don't actually really love like getting ultrasonic. They don't love that stuff. They don't love having vertical bite wings taken.
Yeah. They're probably one of us if they do like those things. So
right. Yeah. I mean, it's just, and certainly there are those people out there, but it's so few and far between, right? Versus you think of somebody who's in retail or someone who is, a chef or whatever, that's in entertainment or food service or any of those things, where people want to be there, right? Or even other medical things where people are sick and they know, some of my favorite patients to see are people with toothaches because I know I can help them, right? And they want to be here. They want to see me. They need us, right? But when I sometimes see like 37-year-old mother coming in for a veneers consult, and I'm the fifth person that they've seen the consult, the fifth dentist that they've gone to a consult with, like, those are hard appointments. And those are ones that, I don't, at the end of the day, I don't think she really wants to be there. And it's somebody who's shopping that hard is probably not somebody I typically want to treat. And like we just run into a lot of that in dentistry, and you get a day full of those. And it's just tough. It's like as a hygienist, you have those people that you really make breakthroughs on, right? People who come with perio and you talk them through everything, you do the oral hygiene instructions and they get better and they improve. And that's incredibly rewarding. Yes. And for every one of those, there's the 5 people who don't, pick up anything you're talking about and come in and they look the same after their scaling and root planing as they did before. Right. And those are ones that like you just take an arrow through your heart on those, and we just see a lot more of that than other industries do, and it just drags us down. It really creates issues for us.
Yeah, and not to mention, I don't even know how many times that somebody sat in my chair and be like, oh, I really hate, like, no offense to you, but I really hate you, and I'm like, hey, now you can't hate me. You don't know me yet. Right. You can.
No, but it's okay. It's okay to hate dentists and dental team members. We're the only people it's okay to hate now.
I know they say it like it's like, well, I hate you, and you're like, excuse me, do you?
We've never met. Like, yeah, it's a I mean, and we like to think we're tough and we have thick skins and that we can, and most of the time we can. But it's just like you get that right confluence of events where you have a post-op sensitivity patient, then you have a crown that fell off, and then you have somebody who broke a tooth that a filling you already did, and then you have a hygiene patient. You go in to meet them, and they tell you, no offense, but I hate you. Like all those things just pile up, and you just end up going home, and you're just deflated, and those days happen a lot, unfortunately. And I have a friend who's an ENT, and I talk to him about this stuff, and he just is like, it's just nowhere close. Like they don't look at failures the same way. They don't take failures nearly as personally as we take failures. When I described to him different things that we have to make injections feel better, he looked at me like I was talking to him about some alien technology he had never heard of. Like he couldn't fathom why you would want to make an injection hurt less. It just didn't like register. Like, why is that even a problem? Who cares?
You gotta get this fit.
Yeah, like our patients is like, oh, they'll be fine. Like, okay. Like it was just it was such a strange conversation because it's like literally something I think about all the time. Like how can I make injections less painful?
Yeah, exactly.
it was so physicians just don't go through the same things we go through. They just don't. It's a different world for them, and so we're on an island by ourselves. And when you look at the data really shows kind of what I'm talking about. So I'm going to go through kind of some analytics here, and you know, we can, if anybody wants these citations or whatever, you can find me on social and I'll send them to you. So we talked about suicide of hair. And you said that you had heard that dentists have the highest suicide rate.
Yeah,
right?
They were number one. My family was like, why do you want to go into dentistry? And I was like, I don't care what you're saying to me. I'm doing what I want.
So, you know, we've heard that for a long time, right? And it dates back to an article in Reader's Digest in the 1970s where they made this assertion. And so we had a class in dental school called behavioral dentistry, and it was sort of psychology of dentistry. And a lot of it, most of it was, you know, helping apprehensive patients, helping anxious patients, words you should use with patients, words you shouldn't use with patients, things like that. And at some point, I remember the professor, Dr. Stephenson, saying something about this article and just saying sort of anecdotally, oh, it's not real, it's not true. You know, if any of your patients ever say it to you, just tell them it's not real. But I don't remember any citation behind that. I don't remember any science that she showed to back that up. And so I found an article from Vice. Are you familiar with Vice?
Yeah.
Okay, so Vice is a TV network, and they have a pretty big website. And one of my favorite writers started writing for Vice.com. And so I started going to Vice.com a lot because I liked reading this one author's work. And it kind of became one of those web pages that I just go check every day just to see what's there. And so one day I go there and they have this article in their health section that says, are dentists really more prone to suicide? And Vice has a great graphic design department, and they put these great graphics at the head of every article. And this head is kind of a silhouette of a dentist's dead body on top of a giant toothbrush, right? So it's like very evocative art that goes along with it. And it's just like, come on, really, Vice? And so it goes into some of the data here. And so there's a CDC study, a study from the Center for Disease Control in affiliation with the National Institute for Occupational Safety and Health, which is NIOSH. And their data showed that dentists are 2.5 times more likely to die by suicide than the general population. 2.5 times. So that's 250%, right?
Right.
So that's a pretty big number. And then there was a journal article, an article done in 1998 in the, I love this journal, the Journal of Deviant Behavior. That's the name of the journal. I'm subscribing. Like right now, I'm subscribing to the Journal of Deviant Behavior. It was a multivariate analysis of suicide risk among dentists. And their conclusion was being a dentist increased one's risk of suicide by 564%. So at the low end of a number, we have 250%. At a high end of a number, we have 564%.
Yeah.
No matter which way you go in that scale, it's too many, right?
It's not good. Yeah.
It's not good any way you go. And so the ADA did some work on it, and the ADA Center for Professional Success. And what their numbers came down to was dentists have double the rate of diagnosed depression, anxiety disorder, and panic attacks than the general population. And that's self-reported. So that's dentists self-reporting these things, which we know in these things, self-reported numbers are always going to be lower. Yeah. So I don't know what the exact number is, but it's more than double. So you take an average profession, an IT professional, an attorney, a CPA, a physician, and dentists have twice the likelihood of having depression, anxiety, or panic attacks, right?
We all have anxiety.
This, like, looking at that number gives me anxiety, right?
Exactly. If I'm like, oh, okay, family, maybe you were right. Just kidding.
It's a real problem.
Yeah.
It's a real problem. And so, like, we start asking why, right? Like, why it can't just be dentistry. There has to be more to it. So I started kind of trying to look at a few things. And one thing I found was an article from 2016 from the British Medical Journal. And what they found was that 90% of dentists reported musculoskeletal pain always or most of the time. So 90% of dentists are in regular pain.
Yeah.
Now, whether that's neck pain, back pain, shoulder pain, those are
Pain.
wrist pain, right? Now that you can't use an ultrasonic instrument in Texas anymore because of this COVID stuff, we're going to start having some wrist issues for dental hygienists.
Mm-hmm.
You live your life in pain all the time, and you're not going to be a happy person, right?
Mm-hmm.
And so that's where stuff like my friend Uchi Odiatu in Toronto, Canada, and his wellness programs make a lot of sense, right? Eating right, doing physical exercise, all that kind of stuff.
Right.
We know there's actually a article in the Journal of Yoga, which is actually a thing as well. So I've got two journals that I want to subscribe to: the Journal of Deviant Behavior and the Journal of Yoga, where they actually studied third-year dental students and the effect of yoga on their life. And grades went up, their happiness scale went up, and their pain level went down. So adding yoga into your routine, and I'm saying that as someone who's terrible at yoga, right? Like I literally just started a few months ago. And I have to use blocks, and I have to modify and do all of those things. I'm working on it. But I'll tell you, I feel better at the end of a yoga class than I did at the beginning.
There you go.
It just is. That just is what it is. And so, encouraging physical activity, encouraging yoga. I think those are all things that we have to do because we have to get that 90% of dentists who are in musculoskeletal pain at least some of the time. We got to get that number down. We have to get that number down.
What I hear you say is we need to do a Facebook Live of a yoga session, so you guys have
absolutely
a session to follow up on. This is perfect.
Absolutely. If you want a name of someone, I can give you a name of a dentist who does a bunch of yoga.
Definitely. Yes, please.
She's awesome. So then we look at some other factors, and what we see is this was an article also by the ADA in the Journal of the American Dental Association. 38% of dentists are frequently or always worried. So almost 40% of dentists are quote unquote always worried. It could be worried about their practice, worried finances, worried about all kinds of stuff, but they report being frequently or always worried. And 35% of dentists are frequently or always physically or emotionally exhausted. So more than a third of dentists and dental professionals are anxious and exhausted most or all of the time, in addition to being in pain. And now you can see why we have these issues, right? But that course at the Utah Dental Association on veneers will fix it all, won't it, Hartley?
No. Sorry.
Of course not. So we just have to get comfortable starting to talk about this stuff more. And then when you look at the CDC, and if you look at their suicide prevention webpage, they have some risk factors for suicide, and I'll just go through some of them that make sense to dentistry. History of mental disorders, particularly clinical depression. Well, we already know that dentists have 35%, are always worried, and we have at least 2.5 times more people in dentistry have general depression than people in the lay world. So that seems to be like it's an issue. History of alcohol and substance abuse, which is, something that I hear about dentists having all the time, right? I mean, that's something you hear about people who are either active alcoholics or recovering alcoholics or drug users. No matter what, that seems to be something that we hear about in dentistry all of the time. Feelings of hopelessness. You remember that 38% of dentists who are always worried about something? That's where that comes in. Isolation, feeling of being cut off from other people. Again, at the last study I looked at in 2005, 65% of dentists in this country practice alone, right?
Yeah.
Physical illness. Remember the 90% of dentists who hurt every day? And then finally, unwillingness to seek help because of the stigma attached to mental health and substance abuse related to suicide. Again, which is what we've talked about. People don't want to talk about this stuff, right? So it's a huge issue. I didn't know that I had stuff going on. I thought it was just my personality, right? I just thought I had mood swings, and I'm going to show you something You may have to strain your eyes, but I want to see if you can guess what it is.
Okay.
Do you see that?
Did you punch that wall?
I punched that wall.
You did punch that wall. I
I
a
did punch
hole
that
in the
wall. Yeah. That's a hole in the sheetrock that came from my fist. Because of, I don't even remember what, to be honest with you. Like, I don't even remember what caused me to be that angry. And we have a software system that we use for reactivations in our practice. And so what it does is if someone hasn't been in for hygiene in 18 to 24 months, it sends them a notification like, hey, you haven't been in a while. If you want to book an appointment, press 1. I'm making up the specifics. Or if you're seeking dental care elsewhere, if you don't want us to contact you again, press 2. And then it gives them like a short little exit questionnaire. And one of the answers is seeking or I'm getting my dental care elsewhere. And so it'll shoot us an email when we get a response so that we can deactivate the patient so we don't keep bugging it, right?
Right.
So one morning I came in to the office and opened up the office email, and it was a response from one of those surveys that said, I'm seeking dental care elsewhere. And there's a room for people to put a comment.
Right.
And this particular patient, his name was Chris. He put, I'm seeking dental care elsewhere because, quote, Dr. Austin just seems so angry all the time.
Interesting. And that is when you had your aha moment?
Yeah, because I thought I was a really good actor. I mean, I knew that there were times that I let my emotions get carried away. I knew that there were times that I was up and I was down. I knew that there were times that I punched the wall, that I had anger to that point where I would punch a wall over things that were essentially nothing. And after all those things, I thought I was covering it up really well. I thought I was the only one that noticed it. And, I've used the comparison before. I was like, I thought I was Daniel Day-Lewis. I thought I was like the greatest actor in the world. And it turns out I'm not such a great actor.
No.
And not only could patients, patients obviously recognize it, but what's even worse is that my team members could tell. And that's when I realized that I needed to talk to somebody. And so that's when I started seeing a therapist. And it's something that I feel pretty strongly about. I think, I'm not saying that everyone needs a therapist. I'm just saying that every dentist needs a therapist. It's just part of the deal. Like all the reasons we talked about at the beginning, dentistry is really hard. There's a lot of things working against us, and having someone to talk to really, really helps. And what's interesting is therapy used to be a real one-on-one thing where you'd go in and you'd sit on the couch and do the thing. But it doesn't have to be that way. And therapy can be done over Skype. Therapy can be done over chat. Therapy can be done over text message. I mean, there's lots of different ways that it can fit into your life. And probably, honestly, a multi-platform approach is probably the best way to do it. And I was disheartened because I went looking for a therapist in San Antonio. And that's not one of those things. It's not like trying to find out like who's the best, hairstylist in town or whatever, right? Like you don't want to like send a mass text message to all your friends asking about like, hey, you got a therapist you love?
Yeah.
So I looked at like where I knew to look, which is stupid, but it was Google and Yelp, right? It's just this dumbest thing ever, but that's like the society we live in. And so I looked on Google and Yelp, and I went to like the highest rated therapist on Yelp, and I went to the highest rated therapist on Google, and we didn't click.
Nope.
They just sat and listened to me talk. They didn't challenge me on anything, which come to realize like that's why they're so highly rated is because they just didn't challenge anybody.
Yeah.
And I needed somebody to say like, stop being that guy. Stop being the person that punches a hole in the wall. You're a grown man. Get your emotions in order. Go through these processes. And that's the kind of therapist I needed. And so I ended up finding a Skype therapist, that has been great. So, the days of like being locked in, like, oh, I'm in, Waxahachie, Texas, and we don't have a therapist here. It doesn't matter. Like, you don't need that anymore.
And agree with you when it's one of those things that whatever makes you feel most comfortable. Some people cannot talk one-on-one and get out exactly what they're feeling. But if you can send a text message saying, I'm so frustrated right now, or like, please just help me, they'll send you a text back and it can help you.
There are times that it's a lot easier to be really honest over text. than it is to be honest over like in person, like you said.
Yeah.
But Skype really does help, and we're all getting used to it now. And this is something I've been doing for a year or so. So, even before we were all used to Skype and Zoom and all that stuff. But don't feel like you're isolated to your town. There are therapists who are therapists that are specifically specialized in medical professionals, right? And you can find them on Skype. I have yet to run across a therapist who specializes in just dentists and dental team members. But we certainly fit into the healthcare field as far as this goes, and someone who has those skills. My therapist actually is a consultant to the Texas State Board of Dental Examiners in their peer assistance program, right, for their drug and alcohol abuse patients. So she understands, she's dealt with a lot of dentists before. And so, it helps. And sometimes, I will need to talk to her weekly. Sometimes I need monthly. It just kind of varies. It kind of depends. And so we kind of take it as we go. But I just think it's something that really helps to have someone to listen to you, someone who's non-biased, someone who has a training in how to ask questions and get information from you, and help you see things from other viewpoints, because that's really what it is for me, is seeing things from other viewpoints. The other issue or the other thing that I've done in addition to therapy and trying to add yoga to my routine, to try to bring some balance to my life, is meditation of some sort. And so I don't know if you meditate at all. Do you do any type of meditation?
I used to do a lot more before all of this.
Okay. I mean, all of our routines are so thrown off now that
they're out of whack.
It's really hard. I think so here's where meditation comes in to me. Do you do hygiene now? Are you in an office now part-time?
Currently, I'm not in an office.
Okay. In your previous office, when you were doing clinical hygiene, did you guys do a morning huddle?
We did a morning huddle. And when I did clinical hygiene, I did yoga all the time. And the reason I did yoga was actually to help with my TMJ.
Yeah.
Because of the stress. And I couldn't preach that to my patients if I wasn't doing it myself. And it's a win-win,
Right. The morning huddle, at least for me, is oftentimes a trigger. It's oftentimes one of my triggers, because the morning huddle is not where we read the schedule to each other. And oftentimes we come in and we're tired, and, it's Thursday and it's been a long week, and it's time to huddle. And what it turns into is Mrs. Jones is coming for a prophy and bite wings.
Yeah.
Mrs. Smith is coming for scaling root planing on the lower right. Blah, blah, and they just read the schedule.
Yeah.
And I want to punch the wall, because that's not what I can read the schedule in my office.
Right.
Surprisingly, I was taught how to read, and I can read. And I assume that most of the people on my team can read. So when we get together and we read the schedule to each other, it reminds me of when I was a kid and when we were in church, and we would, and certainly there are some denominations of Christians that put a lot more energy and effort into their singing than where I was raised. I was raised in like the whitest bread church. And so singing out of the hymnal was like not an event. It was this. Praise God, amen. It was that kind of church, right?
Mm-hmm.
And that's what we do in the huddle, is we read hymns to each other. Mrs. Smith is coming for prophy, praise God. And that's not the point of the huddle. The point of the huddle is to say, Mrs. Smith is coming in. She just had hip replacement surgery a year and a half ago. Can we make sure she takes her antibiotics? She had asked about whitening at her last visit. Let's talk to her about that again. This, that, whatever, right? Those are the things that we're supposed to come out in the huddle. And so I would find myself being triggered by the huddle.
Right.
And so I would leave the huddle and I'd be angry. So now, this is the start of the day. This is 8:05, 7:55 a.m. and I'm already pissed. I'm already at 30 miles. I'm already at 60 miles an hour, right? Is what my rage level is saying. So what I started doing was we do our huddle.
Okay.
I go back to my office, I close the door, and I sit down and I turn on a guided meditation for 10 minutes.
10 minutes.
and I use my phone. I put in earbuds and I put on a sleep mask, and I sit in a chair, and I have the earbuds in and the sleep mask on. And for 10 minutes, I do a Calm is the name of the app. Although there's a bunch of guided meditation apps, it doesn't really matter which one you use.
I use Sanity itself. There's mine.
Yeah, so they all do roughly the same thing. The point is just having someone guide you through sort of the process of trying to turn off your brain. Yep. Now, my mentor is a guy named Bill Robbins, who's a spectacular dentist. And at some point early in his dental training, one of his mentors was somebody who was really into transcendental meditation, which is like a whole deal where you have like a mantra that it's only for you. You never tell anybody what your mantra is, and you can like zone out for an hour like by yourself, right? And that's a skill, and that is a skill I don't have. I was never trained in that skill, so I can't self-meditate. I have to do a guided meditation,
and that's
and that's totally okay, right? And there's a female dentist named Dawn Kulongowski who has a podcast called The Peaceful Practice that talks about meditating in dentistry and how important it is. And she gets mad at me because I also say, I always say, I'm not good at it. I need help. And she has to shake me and say, like, no one's great at it. You know, it's work for everybody, you know, and it's just learning the work. And so don't pretend like she gets mad at me when I say she's better at meditating than me. She's like, it's not about being better. It's not something that you get that you can't master it. So you just have to try. Right. But that 10-minute guided meditation for me after the morning huddle, like gets my RPM meter back down a little bit. So that I'm not starting the day, at seeing red, you know? And so when I mix that in with like, we don't do post-op checks first thing in the morning. We mix post-op checks in the middle because I don't want to start off my day with something that, you know, makes me feel bad, you know, like me adjusting the bite, like, oh, I should have had this done already, you know, or someone that got sensitive after a filling. I don't want to start my day with that, right? That would be like you starting your day as a hygienist by bringing the person that you brought in yesterday for scaling and root planing back to take bite wings and make sure you got all the tartar off.
Right.
Well, if you find a piece of tartar there, you're going to feel pretty crappy about it. Yeah. And that's a tough way to start your day, right?
True.
So don't start your day in doing things that are triggers for you, right? And so and I also don't finish the day that way. So I never see a post-op to finish the day. So I always try to put those in the middle of the morning or the afternoon so that I have a buffer on either side of it between my starting my day and my lunch break and my lunch break and the end of the day, so that I'm not kind of triggered before we head into those things. So being strategic about our schedule, spending some time in meditation, doing some therapy, those are all things that I think, you know, probably should be standard practice for dentists. And some states, like in Texas, we have a requirement. We have to do 1 hour of jurisprudence CE like every 2 years, right? Some states have, now we have opiate. We have to do some sort of opiate addiction training, right? In our CE. Some states have child abuse training. You know, you have to take a child abuse CE every 2 years or every 3 years. There's no reason why it shouldn't be required to take some sort of CE course in this once a year, you know, or once every other year, because it's really important. And we shouldn't have statistics that show that 250% to 565% more likely to commit suicide as a dentist, and that, you know, double the normal rate of the general population of dentists have depression and anxiety and panic attacks, right? That shouldn't be the case. And if we can start educating ourselves on this, start trying to make little changes in our life, you know, to take some of the stress and pressure off of us, you know, then we don't have to have those statistics and we don't have to see those numbers, because they're just heartbreaking. They really are. And I just hate seeing it. And I hate seeing it because I can see an alternate pathway where I go down that way. And if I'm the one that can admit that, and it can help somebody who is not ready to admit that, then that's why I'm here. You know, that's the only reason I'm here.
Even if it's helping one person, knowing that it's okay not to be okay. And it's okay.
It's totally okay.
Yep.
This job is really hard. And like I said, there's about 4 people who are really, really good at it. And the rest of us are just trying to be those guys. You know what I mean? And we never will be. For me, it's my dad. My dad was a dentist. And my dad's the reason that I became a dentist, is because I wanted to make my dad proud. And I wanted to hear my dad say that he's proud of me. And that's all I've ever wanted in my life. And the only problem with that, Hartley, is that my dad died when I was 10. So I'm never going to hear that. Right. And so, what I started to do was take that pain out and blame dentistry for it, and that's not the way to live. And then you add on, dentistry has enough to shoulder with how hard it is, and how much we have to deal with. And so, throw all this stuff on top of it, and it really can get you to a breaking point. So, it's okay to ask for help. It's okay to see a therapist. It's okay to do a guided meditation. It's okay to close the door to your office and close your eyes for a few minutes just to rest and to breathe, right? Mm-hmm. Those are all things that are okay. And I think back, my dad practiced in the 70s. And I'm sure in his office there was a bottle of scotch somewhere. You know what I mean? Like, for at the end of the day, you have a couple fingers of scotch and smoke a cigarette and all was good. And those aren't the days that we have anymore. And so we have to replace scotch with something else, and we have to replace cigarettes with something else. And the things that it should be are therapy, meditation, and learning how to breathe. Those are the things.
Just a reminder, please date your therapist, not in a weird way, but if you don't get along with your therapist.
I thought first, I was like, what?
No.
I get what you're saying now.
I had a therapist and I lied to them. I have no idea why I lied. She asked me a question, and bold-faced lied to her.
Because it's natural.
Yes.
We build up these defense mechanisms that, we are afraid to be ourselves and say what's in our heart and our mind.
Right.
Because we don't want to either make ourselves look bad or hurt the other party.
Exactly.
And that's not how a relationship with a therapist should be. You got to be comfortable with your therapist. That's what they're there for.
So you got to make sure, when I say date, I mean sure that you get along with them, you trust them, and that you don't lie to them. Like I said, I don't know why I did it. It was a subconscious thing, and I had to tell them, hey, you know what? Actually, I got to find somebody different. This is
not you, it's me.
Working. Yeah, actually, this one is me.
That's hilarious. But that's a great point. Couched in a very funny way to say it that made me almost spit up my drink. If you're not comfortable with your therapist, there's somebody out there that you will be comfortable with, and you just have to find them.
Okay.
Do you get along better with a male therapist or a female therapist?
I've actually only had, I guess I've had one male. I don't know.
You don't have a difference?
No, I don't have like a male or female. The other ones that I found have usually been female. Those are like the recommendations that I've gotten. But I know that, like, for some males, it's hard to talk to women, or it's hard to talk to another man that would rather talk to a woman.
Yeah, I would rather my therapist be a woman, and I think, and my therapist now, we've talked about this, and her thought was, that I had said something about, like, I need somebody sort of nurturing and maternal, and the thought was because my dad passed away when I was young, I'm not used to having that sort of paternal relationship. And so it's out of my comfort zone to have that. So it's why a female therapist is much more comforting to me, because that's what my sort of childhood construct has been. And so whether or not there's anything to that, I don't know. But I would say try both and see who you work with, see who you click with best. And, I don't know, but I do find that most men click better with a female therapist. I don't know how it stands with females, if it's better with a male therapist or a female, but most men tend to click better with the female therapist.
Right. If you really want to date your therapist, just ask permission. Just kidding.
Yeah, I don't think they can be your therapist anymore. So you have to find a new therapist.
I don't think so either. Okay, well, let's wrap this up. Is there any last things that you want our awesome Ultradent family to know, to hear, to give them words of encouragement for?
I mean, you said it before, it's okay to not be okay. And I think that's something that we have to be comfortable with and know that, hey, you're not alone. And the statistics say you're not alone. The studies say you're not alone. So don't feel like you're alone, and don't let it get to that point. Reach out to somebody, reach out to a professional. But if you can't find a professional, reach out to a friend, reach out to a colleague. But really, I think finding a therapist is really important. I've been to lab courses, or I've been to CE courses about finding the right lab tech. Right? I mean, literally like a 3-hour CE course about finding the right lab tech. Like, why isn't there the 3-hour course on finding the right therapist? Because arguably a therapist will make a bigger impact on your life than your lab tech will. So find that right person, have them be part of your team. Look at it like finding your lab tech, like finding your attorney, finding your CPA. It's part of your team. It's part of your support team. It's just mental support. And that's as important as any of those other things.
Agreed. I will make sure to drop in the comments after we are done with this, those 2 apps. So I know Josh uses the app Calm for guided meditation. I use one called Sanity and Self. I will drop both of those there. And there are a lot of different platforms that you can use for your therapist. Josh mentioned Skype. I know some people do Zoom. I know Talkspace. There's a lot. So I'll find some and then I'll drop those in the comments as well, just in case you're to that point where you need help, but it's also one there where you can't find help yourself. We'll give it to you. Okay?
Absolutely.
All right. Thanks, Josh. It was great having you on.
Thanks, Harley.
We'll talk to you soon, everybody. Have a great rest of your Tuesday. And Cinco de Mayo.